first of all, I'll say that I'm not a lupus expert, but I do, we deal a lot with chronic medical issues, people that come to the hospital, so we kind of get familiar. So I'm going to talk about how to improve your experience when you come to the emergency department, because indeed you can improve what happens as you go through the emergency. Oops, sorry. So unfortunately, having a chronic illness means trips to the emergency department. They're inevitable. And once you get to the emergency department, the challenge is always whether this is related to lupus or is it a separate condition. Unfortunately, when you go to the emergency department, it takes time to be there. You're not going to get in and out quickly. I just looked on my phone. In Alberta, we have the ability to look and see what the wait times are to be seen in the hospital. I see the Children's Hospital is 3 hours, and the Foothills, the Rocky View, they're all close to 2 hours. So that's even before you get in. So you have to prepare for that. The questions, are will treatment be outpatient, or is it, are you going to be admitted to the hospital? Most emergency physicians may not have a lot of expertise or knowledge about lupus. So you might have to be a bit of an educator as you go in. So I'm just going to start off with a couple little studies that I read about. What patients with lupus do end up in the emergency room. And this was a study of 164 female, because predominantly lupus is a disease affecting women. And the commonest causes in this study were fevers, polyarthralgias, which means multiple joint inflammation, and abdominal pain. And out of that group, a fairly large number of them needed to be hospitalized. What they found in this study, when they looked at all the different factors, were there were certain things that led to greater risk of being hospitalized. And one of them, you heard about it before, was poor medication compliance. Another one was people that are treated with lower doses of hydroxychloroquine. Another one was a higher disease severity rating, so the more illness. Another one was positive scale rating for depression. So we've also heard tonight about the psychosocial aspects of the disease. And then lower socioeconomic status. So those are people that are a bit more prone to being hospitalized. Then why are people with lupus hospitalized? What are the common conditions? And this was a Canadian referral center. It's actually Victoria and London, Ontario. They looked at 154 hospitalizations. Average length of stay was 8.5 days, which is a little longer than most illnesses. 22 people needed ICU care. And the commonest conditions were lupus flare and infections. That was followed by adverse drug reactions, and then pregnancy complications and labor. So the commonest things are flare and infections. So before you go to the emergency room, what should you do and what should you take with you? And I think that probably the most important thing is to take in a list of your medications, to have a really good, accurate, and up-to-date list of what you're taking, the doses, is really important. And that would include not only your prescription drugs, but things that you might take regularly over the counter, like if you're taking ibuprofen or Aleve regularly, or if you're taking a lot of Gravol because you're maybe having trouble sleeping. Also vitamins, if you're on a multivitamin or a high dose vitamin treatment. And then there's herbals. People with lupus often, end up seeing naturopaths too, and what kind of prescriptions are you getting from them? And of course, now we have the new issue more frequently of cannabis. And are you vaping? Are you doing oil? Or it seems like everybody's going to try it. initially, and so that's an important one. Also, your drug allergies, if you can, know what your allergies are, that's very important. So we have Alberta NetCare. When you come to the emergency, we can look up what drugs. It's not always accurate though, because the pharmacies don't always input the information. But sometimes you can get a fairly good and clear impression. Sometimes if you leave it to the physicians to write it in, this is what it looks like, and it's not so accurate. So if you have keep your list on your computer printed off, that's much better. And those people who are tech savvy now on your smartphone, there's all sorts of apps for health information and putting data on there, including medications and allergies and things. So the other thing that I would encourage you to, if you're not already doing, is to keep a little portfolio about your health information and try to keep it updated with things about your medical history, documents that you might have or get from your physician, such as consultations from specialists, maybe recent lab work that you've had done. Keep a list of who are your specialists, maybe their phone numbers too, because if you come in to the hospital during the daytime, sometimes the emergency physician might be able to call them and get in touch with them and find out a little bit more about your background, past conditions, surgery, and pregnancy issues. Again, with the specialist information, it's really good if you keep more details of that, because we have a pretty good in this province. We have a very good system called NetCare, where we can go in and look up lab results. We can look up specialist reports, but it's only as good as the input. So if your specialist is just handwriting notes for their file, like it's just it's not an electronic file, those are not going to end up on NetCare. If things are on NetCare, we can access it from any doctor's office or anywhere in Alberta. So if your specialists are dictating note, or if they're at an AHS site, it can end up in NetCare, and that's very useful. But sometimes we don't have that information. So again, that's just about the medical information folder. The green sleeve, I don't know if people that may have been frequently in the hospital have seen the green sleeve, which is basically a reflection of what people's goals of care are. And we can talk about that more later, but with chronic illness, and particularly as it becomes more advanced, people may have developed certain thoughts about what level of care they want. There's areas like R, which is full resuscitation. It's different levels there. There's medical treatment only, the M level of care, and then the C level, is more like comfort care or end of life care. So you may or may not have one of these if you've been frequently admitted to the hospital, but it's something that they will ask you about when you are hospitalized. So once you get to the ER, your first experience is with the triage people, who will take initial history and then decide somewhat about whether you've got an emergency problem, need to be seen quickly, or if you go on to the kind of the waiting list and wait for a spot to come open. Next, you'll have an initial nurse visit where they will take some history and get your medication list from NetCare, and also order initial tests. They may send you off for an x-ray or even do a little preliminary blood work. Then the doctor, emergency physician, will come and visit you and review all the information, any preliminary tests, take a history, do a physical examination of what your concern is, and then order some more appropriate tests. With complex medical conditions, they may be calling in specialists to come and see you. So it might be like house here, you might get a medical student first or a resident, and then, so again, these are all things that increase the complexity and the amount of time that you might be waiting in the emergency. Then once all the results are done, they notify the physician to come back and he'll review the tests, try to make a diagnosis hopefully, and recommendations about any changes, and then follow-up instructions. So what I would encourage you to do though, if you go to the emergency, is ask the physician if you can have a copy of the test results. So if you've had x-rays or lab work, ask the physician particularly, once they've left your side and it's just the nurse checking you out, they don't seem to have the power to be able to provide you with those, unfortunately. So you have to ask the physician, say, I'd like to have a copy of those, please, and they will print that off. You can put it in your little medical portfolio. The other thing is write notes. And if you have somebody in the emergency with you, have them participate in hearing, what they're telling you, because they've done plenty of studies that show that people only hear a very small amount of what is told to them, because anxiety, you're feeling ill, you've just been told you may have a new condition, you've got medication changes, so write notes. Ask for documentation. I put 4 ears are better than 2. If you have another person listening, they can help fill in the blanks as well. So after that, you'll either be discharged home with your new prescriptions or recommendations for further tests, or you'll be admitted to hospital. And so admission to hospital, you may go under a hospitalist, which is what I do. We're family physicians in Alberta. The hospitalist program, our family physicians. We're kind of like the quarterback. We coordinate care and pull in various specialists as required. Or you may be admitted, if you're more ill, to an internal medicine or subspecialty program. I'd just like to, you've heard some pitches already for an ounce of prevention. That we want to try to avoid the emergency department if at all possible. So that just means it's so important to do things like get your flu shots right now, which are available. If you're a smoker, try to work on smoking cessation, because we know that aggravates the disease. So all those simple measures of care are going to help to keep you out of the emergency. So in conclusion, living with a chronic illness means that you're going to end up in the emergency department. Lupus flares and infections are the main reasons for hospitalization. But if you're prepared to visit with more information about your health, it will really help to smooth your time in the emergency department. I'd encourage you also to, when you go in, be prepared for the length of time that you're going to be in the emergency department. So take things with you like books or your iPad, water bottle, lip gloss, a blankie, because in our emergency department, I know that the heat works best in the summer and the air conditioning works best in the winter. So you'll be uncomfortable. So anything that you do to make your stay there more comfortable will be beneficial. So I think I'll leave it at that.
Britt, can we talk about, we know that there's increased risk of premature heart disease in people with lupus, and we had a doctor we brought in from the US who presented to Rounds a few years ago in Calgary, who described that in some detail. So if a patient in their 20s or 30s is at emergency with lupus, would there be any screening for cardiac events?
Well, this is where you have to know your disease, because I think, if you went into the emergency department as a young person, the chances are, if you were not having lupus, it wouldn't be a cardiac condition most of the time, right? So the other thing about lupus is that you wouldn't necessarily have classic symptoms of heart disease. Sometimes they're not straightforward chest pain, shoulder pain, sweaty. It can act differently. So this is why you have to know your health and be able to say to the physician that you see, I have lupus. I know, I'm worried that this is cardiac disease. I think you have to help people along, because often, you may know more about your condition, so that you can kind of steer things towards appropriate tests.